Hello everyone, today I'll be talking about Lovenox, also known by its generic name enoxaparin. Lovenox is part of a medication class called low molecular weight heparins. These drugs are designed to help prevent blood clots in people who are at risk, such as those recovering from surgeries or who are unable to move around for a long period of time. Lovenox works by blocking two important clotting factors in the blood, factor 10A and factor 2A, also known as thrombin. By blocking these factors, it helps prevent new clots from forming and stops the current clots from getting even bigger. Lovenox is used to prevent and treat deep vein thrombosis, or DVT, which can lead to a pulmonary embolism, which is a serious and potentially life-threatening condition. It's often prescribed for patients after major surgeries, like hip or abdominal surgery, those with limited mobility. It can also be used to manage unstable angina, a type of chest pain caused by reduced blood flow to the heart. Lovenox can be given subcutaneously in the arm, another location Lovenox can be given is in the belly of a patient. The subcutaneous locations are where Lovenox is given. Lovenox is given subcutaneously, which means it's injected under the skin. A typical preventive dose for adults is 40 milligrams once per day. Although dosages can vary depending on specific medical conditions that the patient might have. Like all anticoagulants, the most common effect of Lovenox is bleeding. This can range from mild bruising to more serious bleeding events. In rare cases, patients may experience allergic or anaphylactic reactions. Lovenox carries an important black box warning for the risk of spinal or epidural hematomas. In patients receiving spinal anesthesia or undergoing spinal puncture, these hematomas can cause long-term or even permanent paralysis, so this risk must be carefully managed by healthcare providers. Lovenox should not be used in anyone who is allergic to enoxaparin, heparin, or pork products, or in those who have active bleeding. Caution is also advised for patients with recent trauma, GI ulcers, or recent surgery, as these are increasing the risk for excessive bleeding. When it comes to pregnancy, Lovenox should be used only if it's clearly needed. Although unfactored heparin is usually preserved for women who need an anticoagulant while breastfeeding because it doesn't enter breast milk. Lovenox may be used during pregnancy while caution and medical supervision. In summary, Lovenox, or enoxaparin, is a low molecular weight heparin that provides effective protection against blood clots by targeting key clotting factors 10A and 2A. It's a vital medication for preventing complications such as DVT and pulmonary embolism, especially in people recovering from surgeries or not moving a lot. However, it's a powerful medication. It should be used under the provider's supervision.
Lovenox is a low molecular weight heparin, which is a type of anticoagulant blood thinner. It is commonly prescribed to prevent blood clots in high-risk situations, after surgery, prolonged bed rest, hospitalization, treat existing blood clots such as DVT or pulmonary embolism, prevent blood clots in patients with certain heart problems, like unstable angina or during heart attacks. Lovenox works by inhibiting blood factors in the blood, mainly 10A, to a lesser extent, thrombin. This slows down the clotting process, reducing the risk of dangerous blood clots forming in your veins or lungs. Lovenox does not dissolve existing clots, it only prevents them from getting bigger. Before starting Lovenox, your doctor will review your medical history carefully. It is critical to share all your recent history with your doctor. Hemophilia or inherited blooding disorders, history of GI bleeding, brain bleeding or internal hemorrhage, history of low platelets, thrombocytopenia. Lovenox increases your bleeding risk during pregnancy. Your doctor may adjust your dose or timing before procedure. Lovenox is partially cleared by the kidneys. Impaired kidney function may require dose reduction to avoid overdose and excessive bleeding. Liver dysfunction can cause clotting factors. Your doctor may monitor liver enzymes and clotting times. Certain heart conditions like unstable angina or recent heart attack may influence Lovenox dosaging. Lovenox is sometimes preferred over anticoagulants in pregnancy because it is not crossed in placenta, but dosing and monitoring are crucial. Allergy itself to Lovenox, heparin, or pork products, since low molecular heparin is derived from pork. Many medications or supplements can increase your risk of bleeding when combined with Lovenox. You should bring a full list of medications to your doctor. Warfarin and rivaroxaban are a type of medication that might interact with Lovenox. Increase the risk for serious bleeding. Aspirin, NSAIDs, ibuprofen, and naproxen. These can reduce platelet function and increase bleeding risk. Herbal supplements such as garlic, ginkgo biloba, ginger, fish oil, turmeric may have mild to moderate blood thinning effects. Prednisone or other steroids may increase the risk of bleeding, especially in the stomach. Test before starting the Lovenox. You want to get CBC count, kidney function test, liver function test, clotting test, and other monitoring. Avoid activities that increase the risk of getting cuts, bruises, or injury. No diet restrictions necessary. Alcohol can increase bleeding risk. Long travels of immobility can also cause clot risk. Lovenox is usually injected subcutaneously in the abdomen. Rotate injection sites to avoid bruising or irritation. Do not rub the site after getting the Lovenox. Be vigilant of monitoring for the effects of Lovenox. Before starting your medications, confirm your dose with your prescriber, review all your medications, check injection supplies, prepare your skin by cleaning it with alcohol or other appropriate measures. Note emergency contact numbers such as 911. At your take it, how we monitor side effects, how should I know if any bleeding is happening, are there any special instructions for kidney disease?